Good afternoon. I'm Tim Baroody, City Manager, the City of Fredericksburg, again coming to you from the City Chambers at City Hall. I do want to update you again with the help of Chief Mike Jones. We also have a video. I'm glad that the mayor is leading by example. She has taped a video from home with a message to our residents and our businesses. So I'm anxious to let you hear from her. But before I do that, I just want to simply remind folks that we need to also take care of our neighbors, our community, and we do that by stepping outside and saying hello. That's a campaign we kicked off last week, and that is simply to put your eyes on your fellow neighbors. So do that, please, at 6 p.m. every evening moving forward. We do ask for your help to, again, keep an eye on our neighbors, especially the elderly and disabled populations in our community. So without further ado, I'll introduce the mayor, and then we'll have an update from Chief Mike Jones. Thank you.
Hello, Fredericksburg. I'm calling in from home, staying home as the governor told me to do, and actually I've been staying at home for quite a while. I know we're all getting cabin fever. The weather's beautiful. This is a very difficult time of the year to have our activities so constrained. But as the CDC, our medical professionals, and our governor are telling us, stay home, go out only for essential purposes or for a healthy walk. It's more important now than ever to remember why we are doing what we're doing. We know that person-to-person contact increases the transmission and the community spread. We know that staying away from each other works to reduce the spread and ultimately stop it. We have to realize any one of us can be a carrier and not know it. Don't be the person who gives it to the person who gives it to your best friend. Meanwhile, there's much to be considered in the budget that we must pass this spring, and your council and your city staff are hard at work seeking to do such things as to identify latitude in tax deadlines and late fees in order to relieve some of the economic effects of this crisis. We will hold our future meetings electronically. You will be able to view the meetings just as you have in the past, and we're working on ways for the public to be able to participate as well. We do probably have many difficult decisions ahead. I want to thank you in advance for your support and your understanding. Most of all, please keep yourself and your families safe by staying home. We do not want to lose a single one of you. Thank you.
Good afternoon. Let's talk a little bit about some of the action items that the city is doing to try to limit the exposure and prevent the spread of the coronavirus COVID-19, and talk about some statistics. First, the statistics. As of today at noon, there were 174,410 cases of COVID-19 in the United States that have resulted in almost 3,400 deaths. In Virginia alone, we have tested 13,400 people. 1,250 are positive. We have 165 hospitalizations and unfortunately 27 deaths. In the local area, again, we continue to see a rise in cases. We've gone up 3 since yesterday to a total of 36. We have 24 in Stafford, 8 in Spotsylvania, 3 in King George, and then due to contact tracing, we're now down to only a single case in Fredericksburg. The other individual actually lived in one of the other jurisdictions after they did some contact tracing of that. But as you can see, the numbers continue to rise. Hospitalizations continue, so we are far from the top of the curve. City government continues in full aspects, although with a limited footprint. Again, no public access to city buildings, but all city services are continuing on. Police, fire, EMS, trash service, water and wastewater treatment are being done at full capacity. One thing that we do want to remind you is to keep the wipes out of the pipes. Yesterday, the city did suffer a backup in one of the sewer lines that was attributed to material that was put into the sewer system through flushing material that really doesn't go into the wastewater treatment. So really, when you look at it, please make sure the only thing that you put into your toilets is toilet paper. all the other wipes and things that say they can probably go down there, really do a number on the water system and wastewater system that we have, and we don't want to have those blockages. They just create problems for everybody. So let's talk about some other things. Let's talk about when should you call 911 for an emergency, especially during this crisis. So let's talk about calling 911 when you have the following problems: having difficulty breathing or are choking, having an allergic reaction to the medication or the environment, like bee stings, have symptoms of a heart attack or stroke, are confused, dizzy, or disoriented, have difficulty speaking, walking, or seeing, or have sudden severe pain anywhere. Those are the things you should call 911 for. What about some things you should not call 911 for? How about wanting information on COVID-19? There are many websites and other places you can get information on COVID-19, and we'll talk about that in a minute. Needing a ride to a doctor's office or an urgent care facility is not something you call 911 for. Wanting to get tested for COVID-19 or have mild symptoms like colds and allergies. Those are the things that you don't need to call 911 for. If you have questions about the coronavirus, known as COVID-19, you can reach out to the Virginia Department of Health's call center. They're available from 8:30 in the morning till 5 p.m., Monday through Friday, and their number is 1-877-ASK-VDH3. That's 1-877-275-8343. Or you can contact the city through the city manager's office at 540-372-1010 during normal business hours, or we're always available at www.fredericksburgva.gov. Thank you.